Hello everyone, this is Dr. Khan, Executive Plastic Surgery. So this is a very nice, interesting Facebook Live. So this is a 50-year-old patient, comes to me from out of town, and she has implants from 2005. Saline implants, the one and only, through the inframammary crease incision and below the muscle. And so she has on exam what is a right implant that is very much quote, grade 3 capsular contracture on clinical exam, quote, with abnormality where it is contracted and looks abnormal and hard capsule. On the left, she has a significant less volume and it looks deflated, no contracture, and so she comes in, the sign symptoms of breast implant. Unless a patient that's very well read, knows a lot about my practice, and her presentation was very, I used the word interesting. Now, as you will see, 100% total capsulectomy, A2025 initials, LH. So as soon as I go in, you will see these are the proline sutures that are removed. And you will see them up here as well. Proline sutures that are removed that were put on the side to prevent lateralization and to hold the inframammary crease in check. And this is what I removed. So anything foreign, I will remove. Now the other thing I want to show you is look how thin the capsule is. And these are supposed to be the saline implants, and I'm very happy and content with how the whole dissection has gone. Complete removal of the entire implant capsule. And you can actually, if you go like this, you can feel the crunchiness, if you will. So as I go in, it's going to be a little bit tricky. Remember, this is inflamed tissue, so I wanted and I had to remove. Remember, the breast tissue above the muscle was not touched. So I am below the muscle and there's no extra volume that I'm removing. Inflamed tissue. Now, as you will see, this is not tissue. This is scar tissue, capsular tissue. And she has had the capsular contracture. So if I palpate this, it's abnormal and thick and irregular. So that's why I incorporated it. I'm going to go in. I'm going to go in here. There we go.
Hold on 1 second.
What's going on?
The YouTube live.
Okay. So as I go in, you will see how thin the capsule is right here. If I put the ruler, you will be able to see. I'm going to go ahead and take the ruler as I put in. This is how thin the capsule is. So no matter how thin the capsule has to be removed. And you'll see why in a second. So as I remove this, relatively thick capsule. And I have a sterile pair of gloves. And I'm going to go ahead and grab some of this fluid in the bag. And if I go like this, you'll see it's very subtle, but you'll see that stickiness. And this is the leaching of the silicone from what is a McGann 360cc implant. Now this is the purpose of the Facebook Live. As you will see, this is like saran wrap. We have seen this many times before. So thin. If I put the ruler here, you can see it's like a transparent membrane. No matter how thin the capsule, it has to be removed. This patient has a low BMI, not much fatty tissue, but this goes to showing you it is done completely. And I'm gonna let this air dry and you'll see this is gonna get even more crunchy. And you can see clearly by touching it, this is not like human tissue. This is scar tissue. This is the capsular tissue. And you can see I'm going to form some like spider webs just by pulling it. Abnormal. Some areas thick. So as you will see here, let me show you. This is interesting. So here's your suture material. And I don't like suture in the proximity of, and you can see this was rubbing against the implant, and it can certainly cause trauma, i.e. hurt. Because remember, this is like kind of a barbed wire or like a wire that is going to cut into the implant. And all this tissue around is inflamed and angry. You can see like the scar tissue, and it feels different. There's scar tissue around what is a suture granuloma type of an appearance. So no matter what, any foreign material is removed, and again, it's crunchy capsule. Now I'm going to remove my sterile top glove, and I'm going to go to the left side. Remember, that was the deflated side, significantly less volume, and you can see how it's like a deflated waterbed, if you will. And so I'm going to go in over here. This is like a... So the patients have asked me which one is easier, the deflated one or the ruptured implant. The ruptured implant is always harder. So as you will see again, capsular tissue that's paper thin. You can again see so look at this fluid around it. Look at this leaching, and very slippery. This is your McGann 360. Now what I'm going to do is I'm going to just try to see if I can find a leak or something, usually around the valve. So nothing over here. So nothing again. Oh, there we go. This is that leak. There you go. Here's like your leak. That's why it had partially deflated. And again, as you will see, capsular tissue. So look at this fatty tissue right behind this very thin capsule. So one of the patients asked, do you remove inflamed tissue? And I said, you bet. Because this is that very thin capsule, as you will see. And look at these irritated capillaries, whatnot else, and clinical. And this was, as I was dissecting, I saw all of this tissue. That's why I incorporated it along with. And so no matter how thin the capsule, all inflamed tissue completely removed. And then we'll send this off. So very interesting. We saw that hole. It had deflated enough to the point where it was a very small hole, so that whenever she would apply a lot of pressure, I guess some of it would leak out and the body would absorb it. And so clearly this is what is suggestive of a damaged implant, 20-year-old set of implants. Now, if you look at her complaints, saline implant, she has the same complaints as a silicone. So back then, from 1992 to 2006, that they had banned the silicone implants. They should have banned the saline implants, if you ask me, because they have the same complaints, interchangeable complaints between patients who have intact saline, intact silicone, ruptured silicone, or residual capsules. In my practice, I remove the residual capsules if noted and not done correctly by the other surgeon who did the explant. So as always, the implants will be returned to the patient. The capsules will be sent to pathology, rule out the PLLC, LCD for the analysis, rule out lymphoma, rule out malignancy, cultures for Arabic and Arabic and fungal. No need for a lift in this 50-year-old clearly. She got the pseudo lift, twilight deep sedation, no need for drains. She has the high definition pictures and videos of the chest wall showing complete removal of the capsule, and certainly this, as you can see, the capsule went all the way up into the upper part of the chest, and remember this is where the implant normally would sit when it was placed, and now over time it has moved down and outward. And so all that capsular spread all the way medial to lateral, superior to inferior, that has been all removed along with the implant and capsule and all of the inflamed tissue, such that only good, healthy tissue remains behind. And so there you have it. She gets the same surgery that all patients do, and we'll see what she does post-op minus her symptoms or what is suggestive of what is fresh in the house. This is Dr. Khan, Executive Plastic Surgery.